Hello friends. So after a long time we are back with a new video, and in this video we will be discussing a question that is often asked to us. How do we do retina surgeries? Now I'll just like to share a small anecdote before we start with the proper presentation. Few weeks ago, a patient who had undergone cataract surgery 2 years ago came to us with sudden loss of vision. On examination, we realized that he had blood inside his eyes, and we suggested that we have to do a vitrectomy to remove the blood from his eyes. Vitrectomy, of course, is a scientific term for what you can consider as retina surgery. So he asked me a very simple question, but a question which I thought was quite interesting and needed to be answered. He asked, "Doctor, will you remove my lens while removing the blood?" So, in other words, he basically wanted to know how will we enter the eye without damaging whatever is in the front of the eye, and how will we do retina surgery. So for those of you who may not be quite familiar with what retina is, so here is a small recap of what is retina. So if you could somehow cut open your eyeball, then in the front of your eyes are the structures like cornea and lens, which actually help focus the light rays coming from outside onto the retina. This is the innermost layer of your eyeball, and retina captures the light rays and sends the signals to the brain through the optic nerve. So naturally, if retina is the innermost layer of the eyeball, then it is quite understandable if you may wonder that if something is wrong here, and if I have to operate on this part, so how will I reach this innermost cavity of the eyeball without damaging the structures in front of the eye? Because if I really make a incision or cut in the cornea or the lens and then try to enter the eyeball, all these structures will be damaged. So the patient who asked me whether I have to remove the lens actually was quite justified in wondering that. So look at this eyeball again. If you see, there is an interesting area here. This is what we call the ciliary body, which is part of the middle layer of the eyeball. So you see the outer layer is this layer which is white in color. That's the layer you can see the eyes, the white part of the eyeball. And then of course innermost layer is the retina, but in between the two, if you see, there is a blue layer. This is what we call the uveal tissue. It has three parts. In the front, there is a part called the iris, which again you can see. You know, some people have brown iris, some people have black iris. So the color of your eyeball is because of the iris. And then there is a second layer which is called the ciliary body. And the last, but another very important part is of course the choroid. So for now, just focus on this ciliary body. This ciliary body again has two parts. The part which is closest to the lens is called pars plicata because it has small finger-like processes to which are attached some thread-like structures that keep our lens in position. So these are called zonules, and if these are disturbed, the lens will get damaged. But the posterior part of the ciliary body is a narrow flat part which has no fingers, nothing, which has also very few blood vessels, and this part is called pars plana. This actually also doesn't have much function, much role to play. Interestingly, if you see, the retina extends just up to the pars plana and then it sort of finishes off. So between the two ends or two borders of pars plana, you actually have nothing. You have just sclera on top of it, no retina under it, and you also don't have these zonules which you may damage if you come in front of the pars plana. So this small part, which is around 3 to 4 millimeter from the limbus, is a very ideal place through which we can enter the eye. This is why you may see that the doctors write the acronym PPV when suggesting vitreous surgery. So the PPV actually stands for pars plana vitrectomy. Pars plana, of course, is the area through which you enter the eye, so that you don't end up damaging the lens or the retina. And vitrectomy is, of course, for the thing that we do after entering the eye. We remove the gel rather I should use gel which is inside the eye called vitreous, which basically causes a lot of pathologies. Like for example, in the patient that I was describing who had blood inside his eyes, the blood had stained the vitreous gel, which was no more transparent and therefore causing problem in vision. So if we remove the gel along with the blood, hopefully patient would get back vision. So who was the person who had this amazing idea of that we could enter into the posterior part or the inner part of the eyeball through the pars plana without damaging the things which are in the front of the eyeball? So the man or the person whom we consider as the father of modern vitreoretinal surgery was Robert Mackemore, who came up with this wonderful idea working in his garage some 50 years ago. Amazing, isn't it? So since then, of course, pars plana vitrectomy has evolved significantly. So previously we used to have these quite significantly thick instruments through which we used to enter into the eye, and now we have these thin delicate instruments through which we can enter the eye. Of course, as time goes by, all surgeries are becoming minimally invasive, because the smaller the cut you make, the faster the healing, the less the pain, the quicker the recovery. So let's show you a video of how in the clinic how in the operation theater we actually do pars plana vitrectomy to remove blood. So you see this patient, she has a PCIOL, posterior chamber intraocular lens, and she also had blood. So the surgery begins by making 3 ports in the pars plana. If you see these tubes that I have placed in the eye, they were all purple in color. So that's because these are the narrowest tubes or the thinnest tubes that you can use to do a vitreoretinal surgery as of now. That's called 27 gauge vitrectomy. Once inside the eye, you can see all these yellow whitish stuff. You can't really see the retina. This is all organized blood. Now why did I make 3 openings? Because through one of the openings I am continuously putting water inside the eyeball so that the eyeball doesn't collapse as I take away all the gel that is inside the eye. With the second port, I have placed a cutter to remove all the blood that was inside the eye, and the third port through which I placed a light probe to see what I am cutting and to have a clear view of what we are doing. So in this patient, after the blood was removed, we found that there was a old stroke which had caused the bleeding, and therefore we did laser to that area so that it won't bleed again in the future. To fill up that empty space, we we left some air bubble inside the eye. But then see, once the surgery is over, we gently pull out all these tubes, and that's it. The surgery is over, and you can see the IOL is still in place. So we don't have to remove the IOL or the lens to enter the eyeball. And you can see this patient responded very well to the treatment. So now there is no blood. The retina is clearly seen with all these laser scars, which the scars from the laser that we did. So now we have shared with you how we do vitreoretinal surgery. So hopefully, having seen this video, next time if you hear somebody has been advised surgery for a retina condition, you can assure them that we have a way of entering into the eye without damaging the cornea or the lens. Thank you for your patient hearing, and please follow us and like and subscribe our channel for similar videos in the future. Thank you.